and that's the topic of hypersensitization. This can
Mhm.
live under a bunch of other names: mind-body pain syndrome, tension myoneural syndrome, neuroplastic pain, TMS. And I know it can express in a lot of different ways, different forms of pain. Will you speak on hypersensitization some, what that is, how you think that develops, and where you go with a patient or an athlete that is presenting these kind of symptoms?
It's just basically a total out of proportion response, um, because it's hypersensitized, and what happens is you get these exaggerated efferent signals that are basically alarming the body as to us, of as if like the homeostasis is really lost in the system, and we're talking about physical pain that is manifested into uh, different levels of disability that may not match structurally, but their
Sure.
subjective experience is sure as heck what it is. And but then when looking at the pain syndromes, there's always bigger problems playing out. There's avoidance that's going on that's dramatic. Like for instance, a CRPS case of this young woman that was a swimmer in decent shape, and once she had hurt her ankle, it was she went into such a protective mode, and she went to a doctor, and the doctor said, well, don't put any weight on it whatsoever, but there was no fracture. And so she literally floated this thing around using two axillary crutches for 2 weeks, without any splint or device to like maintain the integrity of the joint position. And so obviously, as soon as she goes to put her foot down, she already had a plantar flexion contracture to the point where her heel couldn't even come down, and obviously she was a little high strung. And
Hmm.
that's a common case, just like I noticed on frozen shoulders, which are super hypersensitized. The most common population tended to be like soccer moms that had like 2 or 3 kids and was managing just crazy amounts of activity. And it's like I noticed that the control and the inherent inability to release control was one of the main factors in all these conditions. Really trying to focus on different mechanisms and methods of inhibition, of using manual techniques to help you desensitize areas. uh, Started to use breath work as a mechanism to downregulate the nervous system, and then really get interested in other mechanisms that potentially can influence the autonomic nervous system. I've become obsessed with that.
Click here for the full discussion with Dr. Robby Ellis. We discuss topics of chronic pain, athletic performance, knees over toes training, and a lot more. If you like the video, give it a thumbs up and subscribe for new videos every week.